by unwashed hands. Even in hospital environments, there are billions of bacteria which cause disease. It's often well-meaning nurses or doctors who can be carriers of lethal bacteria simply due to unwashed hands. This is of course particularly serious if these bacteria happen to be antibiotic resistant. In the middle of the 19th century, a Viennese hospital doctor, Dr. Ignaz Semmelweis, noticed that doctors who failed to wash their hands in between examinations passed on fatal diseases to patients. Semmelweis immediately introduced disinfection controls to ensure that doctors wash their hands in soap and water in between patient visits. As a result, the hospital mortality rate dropped dramatically. Later, Louis Pasteur told us how microbes could cause disease. He also taught us about sanitation, sterilization, and hygiene. Unfortunately, studies at hospitals worldwide have demonstrated that many of these simple procedures are often not followed.
I had one consultant. He was the one in charge of the surgeons who looked after my operation. And he admitted to the investigators that he never wore gloves when he dealt with infections. He also said that he wasn't sure about the policy regarding dealing with infections when operating.
This was a consultant?
This is one of the top consultants in the University of Hospital of Wales, whom I'll name in fairness to the other consultants. It's a Mr. Tudor Davies. This same man told me that MRSA was like dandruff.
Dr. Tudor Davies.
Right, what's it regarding?
We're looking to interview him regarding the Ombudsman's report into the John O'Sullivan case.
University Hospital.
Hello, yes, the Department of Vascular Surgery, Dr. Tudor Davies.
University Hospital.
Hello, yes, Dr. Tudor Davies, please.
Hi, I'm not sure where he is at the moment.
I left a message for him and he hasn't called back.
Okay.
But he has got our message.
He has, yeah.
Okay, many thanks. Bye-bye.
Okay, bye.
Not proving very keen to discuss the Ombudsman's report on the O'Sullivan case, and it's easy to understand why. Catherine, hi, I'm Donal. Nice to meet you. Great. It's great to be here. Thanks for looking after us. How did you manage to contract MRSA in the first place?
Well, I was in an English hospital visiting my grandfather who was rather ill, and they reckon I must have picked it up there because I take immunosuppressant drugs, and that means I can pick up infections a bit more easily than the general public. So whenever I go into hospital I was wearing a mask. I wasn't wearing gloves, which is why I probably touched something contaminated and then put it to my face or...
Mm-hmm. Now, do you feel sometimes that you're contagious, or are there times when you're contagious?
Well, obviously I am contagious as I managed to give it to my friend and he ended up in hospital, which was a great shame. And yeah, I do sometimes if I feel like going into hospital, and I do feel a bit, because everyone looks at me very strangely when I'm wearing masks and everything. And I feel myself that I am a risk to the doctors, because if the doctors manage to contract it from me, then, well, in Holland at least, I'm not sure about in England, then it's a big problem for them and they have to take leave off work for quite a while, so I do feel a bit of a burden on them.
This is the border between Belgium and the Netherlands. As two neighbouring countries in the heart of Europe, they have a great deal in common. However, historically, when it comes to the use of antibiotics, they've long been considered worlds apart. Good, how you doing? Very simply, I'm just here for a couple of days, but I've got a cold and I think I'm probably going to need some antibiotics and just want to
Are you producing phlegm when coughing?
No, I'm not producing phlegm and coughing.
But you're allergic to penicillin.
No, I'm not, no.
You're not?
No.
Good. Keep infection away.
Excellent.
Do you smoke?
No, I don't, no.
Good.
Great,
4 soup spoons a day.
great.
And 2 pills. Take them after the meal.
After the meal. Excellent, doctor. Great. So what do I owe you then?
€17.
Thank you very much. Thank you very much. Take care.
Okay.
Nice looking after.
I can tell you now.
During the last 20 years, only 2 new antibiotics have reached the public. The misuse of antibiotics has sent us down a dead end where we can no longer rely upon them as our saviour. In fact, today you can die of a common infection. Mention drug abuse to most people and they'll think heroin or cocaine. But now some of the most commonly abused drugs are penicillin and antibiotics. Hello, can you help me? I'm looking for some antibiotics. I think flu and I need some antibiotics.
But you take amoxicillin or something like that?
Thank you. Great. How much is that?
€9, please.
Thank you very much.
Take 3 times a day one. Okay?
Okay. Thank you very much.
Please.
Bye-bye.
Thank you. Bye-bye.
Hello? Hello. Hi. My name's Donald McIntyre from Media Film and Television. We're doing a film about the overprescribing of antibiotics, and your colleague sold me this about an hour and a half ago with no prescription on the mention of having a cold. I was wondering if your colleague is aware that antibiotics are of no use whatsoever for a cold.
He is.
There is a problem with overprescribing. Is this the first time you've ever given antibiotics off the street?
I didn't.
I know, but your colleague, you know it's very dangerous. You know, the general health.
Yes, but you told me.
I had a cold. I mean, every kid off the street knows. You know, a cold is a virus. Antibiotic is antibiotic.
You look like an adult person, but normally it isn't done.
You know the law.
Don't crucify me.
I'm not criticizing you. I'm saying you should tell us that it's not going to happen again. You have to understand that there are generally huge health concerns about overprescribing, and about antibiotic resistance. And then it's cases like this in pharmacists all across Europe which cause big problems.
So what can I do?
Well, I think just say it won't happen again.
Is that it?
Well, I think yes. I think that's it. I think it'll be fair enough.
It won't happen again.
Okay. Well, listen, thank you very much for that. Okay. Take care. Bye-bye. Now let's test the Dutch system. Can it really be as good as they say it is?
Sorry?
Looking for some antibiotics.
You need a recipe from the doctor.
Yeah, I think it was amoxicillin is the one I usually get for a cold. Do you have amoxicillin?
Yes, that was here, but yes, I only can give it to you when I have a recipe.
Hi, Judith. And what are the symptoms?
A very blocked up nose and bit of a headache.
A little bit uneasy. Full of this one, pain.
No, just some headaches, but not a bit of a cold or flu or something.
Okay. I asked it here and a doctor, and she says as you go home, there you better go to your huisarts. I don't know what you say.
My own doctor is it when I go home?
Yes.
But not to worry at the moment?
Nee.
Okay.
Nee, it's good so.
Okay, thank you very much. Okay.
Okay.
Bye-bye.
Bye-bye.
The lessons to be learned here are all too apparent. We must follow the Dutch example and be much more restrictive about our use of antibiotics, or else the health of all our communities, whatever their nationality, is at risk. The views on the antibiotic resistance problem varies from country to country. So let's listen to Dr. Aznar from Zaragoza in Spain.
para los medicamentos en España simplemente es ir a una farmacia y comprarlos, salvo en una serie de medicamentos que prácticamente están restringidos a los tóxicos. Medicamentos que se emplean para dormir, medicamentos para tratamientos psiquiátricos y los tratamientos de adelgazamiento, en los cuales las anfetaminas juegan un gran papel y demás. Por lo demás, una farmacia es una tienda en la que la gente puede entrar y comprar, ya digo, y la limitación de sustancias que no se pueden comprar sin una receta médica es verdaderamente pequeña.
Buenas tardes.
Buenas tardes. Flamoxil.
Flamoxil, 500.
Sí.
En cápsulas,
Sí.
¿no? Hola. Antibiotic.
This is antibiotic, yeah.
Uh-huh.
Okay, good. Okay, I have this down. Yes. Gracias.
De nada.
Adiós.
En España el antibiótico en la farmacia está completamente liberalizado. No se precisa ninguna receta médica para comprar antibióticos.
Do you speak English?
Yes.
Yeah, good. Because I have some problems with my throat.
Because I can give you something
Yes.
for sucking antiseptic,
Yeah.
but not an antibiotic because that's a doctor.
Okay.
But,
It's not possible to have antibiotics?
No.
No.
Not in Spain, no.
Oh, okay.
It's only with
Prescription.
prescription.
Okay, I see.
Getting antibiotics from pharmacists without prescription is clearly a problem, but increasingly buying these drugs on the internet poses an even greater threat to society. In just 600ths of a second, we were offered 316 opportunities to buy vancomycin, our last line of defense against lethal bacteria.
J'ai mal à la gorge, hein? Oui. Je crois que j'ai besoin de quelque chose. Hein?
Fais ici. Hein?
Oui.
D'accord? La pharyngitis, hein? Pharyngitis.
Sí.
Tu dois prendre un antibiotique. ¿Eh?
Oui.
Oui.
Très bien.
Eso es una barbaridad que se utilicen los antibióticos como se utilizan, eso es una barbaridad, está clarísimo.
Bueno, supongo que cuando tengo algún tipo de infección, ¿no? La verdad es que me automedico, no debería hacerlo, pero es lo que hago.
Bueno. Además soy médico.
It's because in Spain we have abuse.
Okay.
So there's a lot of resistance. It's a problem.
Yeah.
No, los antibióticos no son peligrosos, lo que es peligroso es usarlos con falta de criterio, pero eso no pasa solo con los antibióticos, pasa también con los caramelos de menta. No es preciso ir a una farmacia para que el abuso de una sustancia, no precisamente un medicamento, pueda provocar efectos nocivos.
It's just, I got cold, viral cold and sore throat.